Assalamu alaikum wa rahmatullahi wa barakatuh. How are you, students? Today we will discuss a case of snake bite. I am Dr. Shimaa.compressed-Forensic, Associate Professor of Forensic Medicine and Clinical Toxicology in the Faculty of Medicine at Mansoura University in Egypt. Let me give you an overview of how to protect yourself from respiratory infections. We should keep general and personal hygienes. Avoid touching your mouth, nose, and eyes while you are outside. Repeated hand washing all over the day, 30 seconds at least, while washing your hands. Avoid close contact with persons who show cold and flu signs. You should have a balanced diet, practice some sport, and have enough night sleep. You can consult a physician in case of feeling any symptoms. Let's go to discuss our case. In this case scenario, there is a 36-year-old male engineer patient that was presented to the emergency department in the early hours of the morning with a history of difficulty in breathing and difficulty in walking. The patient gave a history of being bitten in his ankle at his work in the desert. Being an engineer, he didn't see the biting animal. Upon examination, the patient showed depressed respiratory rate and hypotonia with decreased muscle power. Otherwise, examination was normal. This history and these signs and symptoms make a practitioner to suspect a case of a neurotoxic snake bite. Immediately, we should begin our treatment by giving the specific anti-snake antivenin, and since the case is diagnosed to be in mild degree toxicity, we will give 5 vials of the antivenin of the snake, anti-snake antivenin. This anti-snake antivenin is given by intravenous infusion, means it is given slowly intravenous, being diluted in saline, and it should be given in an ICU setting with anti-shock measures in another line. This means we give antihistaminic and corticosteroid in a separate intravenous line. Together with the specific anti-snake antivenin, the specific antidote treatment, symptomatic treatment is very essential, and there should be local bite site cleaning and debridement. In case of this patient, he showed depressed respiratory rate, means he needs respiratory support, and upon patient need was poor respiratory drive, mechanical ventilation was done. Upon close and frequent monitoring of the patient, the manifestations were yet not improved. This means he needs repeated injection of the antivenin, so he was given 5 additional vials of the anti-snake antivenin. And since still there are symptoms, he was given additional 5 vials, so a total of 15 vials of the specific snake antivenin was given. When the patient shows clinical and laboratory improvement and disappearance of all signs and symptoms, he can be discharged safely. We should see the other needs of the patient. In this case, there was residual lower limb weakness, so then we should refer to a rehabilitation therapy to treat the residual weakness in his lower limb. Let's discuss what was done for this case. In case of a snake bite, we should do things and things shouldn't be done. We should keep calm and don't panic upon exposure to any bad circumstance. If there is a hotline, you can call for an ambulance to come to transfer you to the hospital. Avoid doing any faulty measures like tourniquet, ice, suction, or doing cuts at the site. You shouldn't do tourniquet unless you are trained on how to do a tourniquet correctly. Inside the hospital, the snake antivenin is administered in the recommended dose according to the degree of toxicity. If there is no toxicity, and fortunately most snake bites are not toxic, there shouldn't be administration of any antivenin. If there is a mild degree of toxicity, we should administer 5 vials of the specific snake antivenin. If the toxicity is moderate, we give 10 vials. If the toxicity is severe, there should be administration of 15 to 20 vials of the snake antivenin as given by intravenous infusion in a monitored ICU setting with anti-shock measures as we mentioned before. From this case, we can conclude that snake bite diagnosis can be done by suspicion because some patients do not give clear history of exposure to a snake or to be bitten by a snake. Secondly, there should be timely administration of the snake antivenin and symptomatic and supportive measures in order to save the life of the patient. Let's go in a discussion in snakes in general. There are many families of snake. The most known are Elapidae, Vibridae, Hydrophidae, Colabridae, and Atractaspidae. But for us as physicians, we are not required to know these generic families of snake. We are required to know snakes by signs and symptoms. So visual identification of snakes is not important for us as physicians. We determine snakes by their signs and symptoms, so we are not required to diagnose an Elapidae bite or a Vibridae bite or a Hydrophidae bite, but we are rather required to diagnose snakes by their symptoms, as to say vasculotoxic, neurotoxic, and myotoxic snake bite. Vasculotoxic snakes bring symptoms of local edema, hyperemia, swelling, local pain, and cardiovascular symptoms of hypotension, tachycardia, followed by bradycardia, shock, and this may result from respiratory collapse. There may be also hemorrhage from body orifices, and there may be compartment syndrome at the local site that result in severe damage and may be gangrene and loss of. Another category rather than the vasculotoxic snakes is the neurotoxic snake that was in the case given before. As we see in the case, neurotoxic snakes does not bring local signs and symptoms. The site of bite may be totally free without any local pain, hyperemia, edema, hemorrhagic blips, no local sites at the site, but rather there will be neurologic symptoms like ptosis, dysphonia, dysphagia, manifestations of muscle weakness, inability to walk, and the condition ended by respiratory failure and the death from respiratory failure. A third category of snakes present with muscle damage. This is the myotoxic snakes. Muscle damage release muscle protein inside the circulation that will pass to the kidney to be filtered, which is toxic to the kidney, and appear in urine, giving urine a brown color because of myoglobinuria. This is the release of muscle protein inside urine, which is abnormal and shouldn't happen in the usual condition. This bring urine the brown color and cause myoglobinuric renal failure. In this condition, the severe muscle damage may result in limb loss. This denotes that a case of a snake bite should be identified and treated on time without delay. And the treatment is easy and available, which is anti-snake antivenin. In some countries, the anti-snake antivenin is specific for each category of toxic snakes. Means some countries produce the anti-snake antivenin as anti-neurotoxic antivenin, antivasculotoxic antivenin or antimyotoxic antivenin. Fortunately, in Egypt, we have the anti-snake antivenin in polyvalent preparation, means the vial of the anti-snake antivenin is effective against all types of toxic snakes. What to do in case of being exposed to a case of toxic snake, or when you identify a possible snake bite toxicity. This algorithm demonstrates what you should do in case of exposure to a toxic snake. You can study it well, and I will ask you some questions. You can inform me about what is the basis for the diagnosis of a snake bite case. Is it history and examination, or is it laboratory investigation? Definitely it's history and examination. Laboratory investigations are to follow up the patient and to confirm some signs and symptoms like coagulopathy, like secondary renal insult or secondary organ damage. For a case of myotoxicity, we can do specific investigation like serum alkaline phosphatase, such a kind of investigation, but mainly the diagnosis depends upon history and your findings of clinical examination, signs and symptoms. Laboratory investigations are very important to follow up your patient and to confirm diagnosis of some signs of toxicity like muscle damage, like coagulopathy. And before you discharge your patient, the patient should be completely clinically and laboratory free. Let's have some MCQs regarding snake bite. You can answer these MCQs and short questions and get me back if you didn't know anything or if you need help in any part. If you have any question, anything difficult after studying the case, you can get me back. Here you have my contact details. You can communicate with me at any time, and I welcome your questions and your communication at any time. Keep safe and healthy, and thank you.